Marsh, and this is EdCast, a program created and produced by educators for everyone interested in education. Today on EdCast, we follow some student journeys from Hostos Community College to Columbia University and into the future of public health. Programs like the Next Gen Public Health Scholars Initiative are opening doors for underrepresented students while reshaping a field in need of diverse voices and lived experience. How do we build the next generation of public health leaders? We'll hear from students and administrators as we consider the ways access and representation are changing who enters and leads the field of public health. Coming up now on EdCast. Joining me today are educational leaders and students entering the public health field. Our first guests are two administrators involved in the Next Gen Scholars Program. Andrea Fabrizio is the Provost and Vice President of Academic Affairs at Hostos Community College, CUNY. She's been a member of the Hostos community since 2003, serving in multiple roles, including faculty member, writing across the curriculum coordinator, English department chair, Dean of Academic Affairs, and now Provost. She works closely with academic departments and student support services to increase the college's retention and graduation rates through a variety of innovative programs and grants. Her scholarship focuses on writing pedagogy, the role of the humanities at community colleges, and early modern and 18th century English literature. Curtis Rogers is the Vice Dean of Columbia University School of General Studies. With more than 25 years of leadership in higher education, Dean Rogers has extensive experience identifying and enrolling high-achieving adult and returning learners, veterans, community college students, and other student populations, and developing enrollment, transfer, and retention strategies tailored to their needs. Working with community colleges, he has designed and launched pipeline and partnership programs, including the Global Scholars and the Next Gen Public Health Scholars Program. In 2019, Curtis Rogers was honored at the Columbia University Military Ball with a Lifetime Achievement Award for his work with service members and veterans. Thank you so much both for joining me today on EdCast. I don't think the public and even members of the Academy are aware of the many programs that are out there that are partnership programs between community colleges and four-year colleges, and the way we're using this to give access not just for students, but to other fields. So I want to start with you because we are talking today about the Next Gen Scholars Program. What is that program exactly?
Well, it is a wonderful partnership between Hostos Community College and Columbia University, where our students from any majors can apply for this opportunity to transfer into careers and the future in public health or epidemiology at Columbia. They need a 3.2 GPA, they need to be close to graduation, and then they go on to Columbia with financial support to support the completion of their bachelor's degree and their master's degree. And it is something that came out of the leadership of our president, Daisy Coco de Filippis, with our Mackenzie Scott grant to support that. And then it was further supported with our Congressional Earmark Scholarship that we received and expanded it to other fields as well. But that is what it is. It's a wonderful transfer opportunity.
So the criteria are, just to review again, the GPA and what else?
They need a certain amount of credits, so they need to be close to graduation. So that
Any recommendations required?
They should have some recommendations from faculty. They have an interview process, but that is the idea, that it would support the students completing their final year at Hostos, then to transfer to Columbia.
Now, what did it take to build this bridge with Columbia?
Well, a great partnership, and a lot of thought into how the curriculum aligns in the way we send our students over, and the structure and the support that they have once they go to Columbia. And again, also that financial piece, that support that we had with the Miss Mackenzie Scott's gift and the Congressional Earmark Scholarship.
So did you work together? Did you meet together to talk about curriculum or things like that?
I know that Dr. Sofia Oviedo at Hostos worked extensively also with Dean Rogers and the Columbia folks to work on that partnership too.
Good, just a minute. So in terms of the public health force today, is there a shortage of public health workers, people in the field?
Well, it's an ever the demand for it is just ever increasing, and it's just an amazing opportunity for our students as a career path. And I don't think there can be enough people going into that field to really serve the needs of the community and meet that demand.
From your experience, from what you know now about working with this field, is there a diversity problem in the field in terms of who gets to work in the field?
Well, I think that there needs to be work done to make sure that people who are in the field are representing the communities that they serve, and that I think is one of the wonderful things about this partnership is that it gives our students, as Hostos is located in the poorest congressional district in the United States, and 95% of our students are of color, that gives them this opportunity to diversify the field.
To you, what does this program say about the potential of our students?
I think what we already know about our students, that when you remove the financial barriers, the things that get in the way that are outside of the academics, that they can do anything.
Right. So let me go to Dean Rogers here. Why do you feel it's important for schools like Columbia to partner with a community college like Hostos?
Well, when we look at this particular program, in addition to everything Andrea just shared, this program was born from the post-COVID-19 moment. And really, the sense that we need to do better in terms of who represents us when we think about big problems like that. I have to give credit to Dr. Charlie Branis, who's the head of our chair of epidemiology at Columbia School of Public Health. And his work really looking at the problems around COVID-19 and really looking at where communities were impacted, how they were impacted, and saying, we need to do better getting people involved from those communities in those solutions. And I think that was one of the first things that really struck up the conversation around this, to partner with Hostos Community College, serving the district in the South Bronx, and to allow for students to find entry into this professional pathway.
What do you feel that students from community colleges bring to this program?
I think the most important thing, and this is embedded in the college where I'm vice dean, where I work, and look at students through the admissions prism. They bring their experiences. We look at academic accomplishment, and we want bright and smart students in a classroom like we have at Columbia. But how you interact in the classroom is deeply influenced by where you come from, what you've done, where you've lived, the challenges you faced in life. And for us, the School of General Studies, a college that is focused on non-traditional students, we were founded in the late 1940s, 1947, on the heels of the first GI Bill to serve GIs returning from the war. Over the years, that really became serving non-traditional students. And non-traditional students find their first point of reentry into education at the two-year community college system. So for us, partnering with a place like Hostos Community College is really going where the students are, and having those students in the classroom changes the discourse, improves it.
What kind of supports do these students need when they arrive at Columbia?
In a lot of ways, they need all the same supports as any student who arrives. I think sometimes that's an important thing to remind our students of. The transition to an academic setting like Columbia's can be hard. You're asked to work hard, you're asked to do a lot of work. And what we've done is work to build a system that is deeply supported, from the academic advising we provide to the Academic Resource Center, but also ensuring that students feel welcomed and part of the community, that they feel like they belong. One of the common things that students experience when you transition from one academic environment to another is that you don't belong in that environment. And we have to really work hard with our students to ensure that they understand they're there for a reason. They're incredibly talented, they bring a lot to the classroom, and they should be proud of that and confident in that, but that sometimes takes a little bit of time.
Just one last question before we actually meet our students I'm excited about. Have these students changed the way you think about admissions and student success?
Absolutely.
How so?
I've been in admissions for 25 years, dean of admissions for many number of years, and I still oversee the admissions process for Columbia School of General Studies. And something I learned a long time ago is that you look for the traditional measures of academic success. You want to see success in the classroom, but when you fall off the non-traditional path or the traditional path, and your academic record looks a little bit different than, say, the traditional freshman student we admit to Columbia, that's not a disqualifying characteristic. Those experiences really make a difference in how you think about what you want to study, how deeply you think about the problems and challenges facing the world, and we value experience. And so oftentimes what you can see is that a profile that may not look like the profile you typically would take at a university like Columbia, that student excels and is at the top of the class. And that has deeply influenced the way we go about our admissions process.
That's terrific. Now let's hear from the students and see what they have to say about their experiences in this program. We'll be right back with two students who are taking this journey at Columbia. Don't go away. Joining us now are two student participants in the Next Gen Public Health Scholars Program. Hala Antoinette Abraham began her academic journey at Hostos Community College, where she built a strong foundation in community health while working as a community health worker in the South Bronx. Through the Next Gen Public Health Scholars Program, she transferred to Columbia University School of General Studies. She will graduate from Columbia this May and plans to attend the Mailman School of Public Health to pursue a master's degree. She is focused on public health practice and prevention, with a commitment to supporting underserved communities through education, outreach, and improved access to resources. Denisha Noble also began her academic path at Hostos Community College studying nursing. She served as vice president of her graduating class and mentored fellow students. Denisha is currently a Next Gen Scholar majoring in psychology at the Columbia School of General Studies. Her interests center on maternal health and improving patient-provider experiences. In the future, she hopes to become a nurse practitioner while also engaging in public health work to address inequities in underserved communities. Thank you, both of you, for joining us today and for joining us in this conversation. What I want to ask both of you is, what drew you to public health? I'll start with you. What drew you to public health?
Well, it took a turn for me during the pandemic.
Okay.
Because when I was back in Africa, I was studying nursing, which is a clinical, I always had a mindset that I would really love to help people. So when I got the opportunity, I was like, oh yes, I'm going to jump at it. But during COVID-19, just witnessing what was going on in my community, how they didn't have enough resources, how they didn't have access to those resources, or even the misinformation that was going on. And I saw how it had really devastating effects. So it was then and there I told myself, I need to change my career and focus more on public health.
That's wonderful. What about you, Denisha?
Well, for me, my own experience with not only the healthcare system in the United States, but also in Jamaica, it made me aware of the lack of access and how factors other than the hospital system, such as maybe education and the environment, affect people's health. And for me, I wanted to take a deeper dive into the field so that I could make a difference in that aspect.
So let me ask both of you, the decision to go to Columbia must have been a big one.
Yes.
What was your thoughts about doing that initially when you heard about the opportunity? And what made the biggest difference in your decision to actually transfer?
For me, when I heard, first of all, when I went through the process of doing the application and going through the interviews, and then the day I got the letter that I was awarded a scholarship, I was so happy because I know because I had previously studied I was in Hostos by then. I was doing community health, and at the same time I was working. So with this opportunity, I know that it will really further me. It will let me go further in my career, and it will really help me accomplish my career goal. So when I got the message, at first it was exciting, and then intimidating. I'm like, am I gonna go to Columbia? But it actually turned out for the best, and I'm really glad that I had the opportunity to do that.
And what about you, Denisha? What did you think about the idea of going, and what made you decide to go?
Well, honestly, I was in my last 2 semesters of nursing school when I first heard about the scholarship. And then in my last semester, I was encouraged by my mentor from the honors program to apply. She thought it would be a good fit for me. But at the time, I'm thinking, Columbia, it has such a huge reputation. I'll try, but I don't know. We'll see where it goes. So once I got that letter stating that I got in, I must say I was ecstatic. I was actually at a review with my classmates and I just screamed and everyone was like, what happened? And I'm like, I got into Columbia.
It's wonderful. So when you got to Columbia, did anything surprise you? Anything?
I must say, I felt intimidated when I, really thought about the prospect of going to Columbia. And then when I got there, I was afraid that maybe I wouldn't fit in or maybe I didn't belong here. But what really surprised me was the fact that once I got there, I realized that I did. I realized that these rooms that I thought that maybe I wouldn't have access to, I did. And I perfectly fit in because my background offered something different than everyone else's.
Right. Okay. Let me ask Tanisha the same question then. What was it like when you got to Columbia? What surprised you about it?
It was exciting when I got the news. And then I remember my first day at Columbia, when I walked in, I was like, wow, I'm really here. I can't believe it. But then, like Denisha said, it's very diverse. Columbia is very diverse because I had all that feelings. Am I really going to fit in just like her? Just like, I said to myself, am I really going to fit in? What is it going to be like for me, just going through these walls? But Columbia is very diverse and you are encouraged to, be your best and be who you are at the same time. So that's something that really helped me fit in. And at the same time, I was able to excel.
Were there any big differences that you saw between studying at Hostos and studying at Columbia?
Well, I won't say a big difference. Columbia is very rigorous, that I will tell you.
Okay.
So studying at Hostos, they gave us the foundation that we'll use to excel when we go to Columbia, especially after we got the scholarship. We had mentors and, it was just, they really gave us that foundation. Like without Hostos, we won't be able to even thrive in Columbia. So
that brings me to a question then, how I'm going to turn it over to Denisha then. How did Hostos prepare you for this?
Well, I must say at Hostos, we have a lot of resources that help us in terms of we're not expected to be so much independent, and especially being in a nursing program that was as intense as it was at Hostos, it felt like it prepared me for what was to come at Columbia, in that once I got there, while I had to be more independent and while I had to take on most of the, I guess, the adjustments on my own, I felt prepared enough knowing that I was able to do it.
Good. So what do you feel that you bring to Columbia and to this field that students from a more traditional background might not bring? You want to take that?
I bring my lived experience.
That phrase I use in my
Yes.
lived experience.
Yes, I have that, and at the same time, I've seen firsthand what it's like to really, be without, when you're not able to navigate resources. And also through my work, I've heard thousands of stories of, people just like me. They are trying to navigate the health system and it's so hard. So I think with that, I'll be able to really excel in this field, and I will treat my community and each and every person I meet with empathy because I've been there and I know.
How important do you think it is to be part of a cohort like the Next Gen Public Scholars?
Well, especially at a university as big and as diverse as Columbia, it is really important because it's also very easy to feel isolated once you get there. You don't know anyone there, and you're walking around this huge campus, and there's so many faces, and you're thinking to yourself, well, I don't know anyone here. I don't know how to just walk up to someone and be like, hi, let's be friends, But the cohort, we already got to know each other prior to my entrance at Columbia. And that really helped me to feel like, okay, well, at least there's someone I can turn to if there's something I don't understand, if there's something I need help with. There's others with experience that can guide me because of this cohort.
Now, I want to ask maybe everyone, but what issue in public health feels most urgent to you right now? Is there an issue?
Yes. So through my work, I've always thought about, if resources are made available to underserved community, it will really, help them. So I think access to resources, access to education, and access to healthcare, those are the things that are really on my mind right now. And I know with these, I'll be able to really help people navigate the system and be able to have a better health.
What about you, Denisha? What issue feels most urgent?
Well, at the current moment, the issue that I'm most focused on is the increase in the rate of maternal mortality, especially in Black women. And when I was at Hostos, I came across a case that recently happened in New York where a mother died while she was in labor. And I thought to myself, every day someone else is dying in labor. There was a drastic increase over the last couple of years. So I feel like that is an area that we need to target. Something that's supposed to be joyous, like, life coming into this earth, is now a scary thing. So I feel like that is something that we need to address.
That's wonderful. So let me ask then our administrators and all of you, but I'm going to ask the administrators too. You've heard each of our students talk about what it was like to come onto the Columbia campus and that there was a real feeling of adjustment. What do you think it takes to create a sense of belonging for students when they come to Columbia? For our students, let's say, when they come to Columbia.
I think it's about ensuring that we're building community. I think the connection that Denisha mentioned when she walked on campus, that she knew she was part of a cohort with other students who are traveling the same path, really means a lot. To be able to know that there's someone else who's going through the same thing that you're going through or has gone through the same thing you're going through really, I think, helps that transition, makes it a little bit easier.
Were there any support services that you felt you needed or that you were looking for when you got there?
For us, my cohort, we were the first cohort, yes.
Oh, that's exciting.
Yeah, my cohort, we were very close and we were each other's support. And at the same time, we had the faculty and the dean, whenever we have questions or whenever we are, even we could walk to they have the arc that you could go and just, if you are falling behind in your lessons and you have your peers help you. So it was amazing, just having each other.
How do you think diversifying the pipeline into public health, does it have outcomes for the communities? Does it make a difference to diversify the pipeline? What do you all think?
I think it does.
How so?
I believe that what comes with diversity is people from different backgrounds. And once you come from different backgrounds, you have different experiences. So, for example, like Hawa coming from a background where she saw where healthcare was inaccessible, and I'm coming from a background where I was actually a patient in the system and saw how patients were treated. Both of us come with different things, but both things are still important and need to be addressed. So I feel like it's really important where we'll have different ideas coming together to make a better healthcare system.
And so those were excellent points, I have to say. Do you think that we are where we should be? And let me ask Andrea, do you think we are where we should be in terms of representation in the public health field?
I think there's certainly room for improvement there, right? And I think that's why programs like this are so incredibly important to further that, because as Hawa and Denisha both said, I mean, when you bring more diversity, when you bring people from different backgrounds, different experiences, it just makes a stronger system that builds empathy and that builds that connection. So there's a way to go.
I did forget to ask this, and this is an important question that just occurred to me. How do our students find out about this program? There are other scholars programs like Global Scholars. How do students find out about them?
Well, we advertise it all around our college. I know that. We send a lot of information out so that students can be informed, so that their faculty mentors and people who are in their lives can connect them with the program. But we share the information widely at the college.
I know that Hostos is about to do another informing students about the Public Health Scholars Program. Mm-hmm. And so does Columbia do any outreach to other campuses as well to have programs like this?
We have other programs that are of a similar nature, but the Next Gen Public Health Scholars Program is really our partnership with Hostos Community College.
So in terms of the future, we're running out of time. I'm going to ask Hawa and Denisha, what are your future plans?
For now, I'm focused on going to MailMed. And then I know after that, I'm just going to give back to my community.
Pardon me?
I'm going to give back.
Get back to your community. And,
Yes.
and what about you?
Well, currently I'm finishing up my first semester at Columbia, so
Oh.
my plans at this current moment is just to, get through the program, the bachelor's and then the master's. But eventually, my biggest hope and plan is to really make a difference in the system. It may not be a big difference because I'm only one person, but something that makes a difference in someone else's life.
And are there any suggestions or advice any of you have for students who are thinking of making this kind of a transfer before we go?
I just want to say that for both Denisha and Hala, they both talked about being a little reticent at first, like I'm going to Columbia, right? But to take advantage of opportunities. I mean, I think that to have an opportunity like this and to accept it and to go forward with it, to never second guess yourself. That if there's an opportunity there, take advantage of it.
Right? D.
Yeah.
Curtis, any?
I think that's a beautiful sentiment. It's take the leap, take the chance. You can't find the opportunity if you don't take the moment and try.
I want to thank you all for joining me today. We are completely out of time, but this has been such a wonderful conversation and so inspiring. So I want to thank Denisha, Dean Curtis Rogers, and Provost Annie Fabrizio, Paul Abraham. Thank you all so much for joining us. Welcome back to this edition of Ed Bites. Australia recently announced the world's first ban on social media for those under the age of 16. Restricted platforms include Facebook, Reddit, TikTok, X, and Instagram. Companies will face large fines for noncompliance. Acknowledging the difference inherent in implementation, the government nevertheless feels the ban is an important step in protecting Australia's children from the harmful effects of social media. Other countries have now initiated bans as well. Will children survive this ban? We are watching closely for the effects of this radical move. Chalkbeat recently reported on the case against EdTech. Testimony of a neurologist and education consultant before the U.S. Senate linked poor test scores to the use of screens in schools. While Chalkbeat outlined flaws in the research used as the basis for the testimony, it still cautioned that EdTech tools could be causing more harm than good. How pervasive is AI in higher education? A look at some CUNY faculty opportunities reflect AI's growing influence. CUNY's AI Innovation Funding Program will finance select AI projects that support teaching, learning, research, and student success. Priority areas are AI education and literacy, AI in courses, AI-enabled student and academic support, and addressing ethical and social implications. Education Week reports that a new study from a large urban district reveals negative effects of chronic absenteeism on academic performance at absenteeism rates as low as 3 to 7%, rather than the 10% threshold currently used. The correlation between absences and below grade level performance grows stronger as students get older. Unexcused absences are a stronger predictor of academic struggles in older students, particularly in English language arts, while total absences are more predictive of math performance on state exams. That's it for this edition of EdCast. Thanks for watching, and we'll see you next time.
We'd like to hear from you. Please send your thoughts and comments to cunyedcast@gmail.com.